Seasickness, also known as motion sickness, is a common condition that affects many people when they travel by sea. It occurs due to a mismatch between the visual and vestibular systems of the body. Seasickness is the type of motion sickness that occurs when the brain is receiving conflicting signals from the inner ears, eyes and other parts of the body when they sense motion. When you're on the water, the inner ear senses movement, but if your eyes don't see the same motion, the brain gets confused, leading to the symptoms of seasickness. The symptoms of seasickness can vary in severity, but generally include nausea, vomiting, dizziness, sweating, fatigue, headaches, increased salivation, pale skin, and finally, for some, these symptoms can be mild and manageable, but for others, they can be debilitating and severely impact their ability to enjoy or even endure their time on the water. When experiencing seasickness, several treatment options can help to alleviate symptoms. Over-the-counter antihistamines are commonly used. Prescription medication patches can also be effective. Ginger in various forms, such as ginger tea, capsules, or even ginger ale, can help reduce nausea. Acupressure wristbands, which apply pressure to points on the wrist, are also a popular non-pharmaceutical option. Keeping hydrated by sipping water or rehydration solution can help manage symptoms, especially if vomiting has occurred. Finally, eating light, bland foods before and during your time on the water can prevent nausea. It is also advisable to avoid heavy, greasy or spicy foods. To prevent seasickness, especially if you're prone to severe symptoms, consider the following strategies. Choose a cabin or seating area in the middle of the ship where movement is less pronounced. If possible, stay on deck where you can see the horizon. Minimize exposure to strong smells such as those from engines or cooking areas, which can trigger nausea. Taking anti-motion seasickness medication an hour before departure can preempt symptoms. Keeping your eyes on the fixed point, such as the horizon, helps align the visual and vestibular signals to your brain. Finally, engaging in activities that keep your mind off the motion, like light conversation or reading, if they don't worsen the symptoms, can be beneficial. In rare cases, seasickness can become a severe medical issue, particularly if it leads to prolonged vomiting and dehydration. If seasickness is an extreme and persistent, it can result in severe dehydration, electrolyte imbalances, low blood pressure, and nutritional deficiencies due to the inability to eat. When seasickness reaches this level of severity, it's crucial to seek medical attention. Intravenous fluids may be necessary to rehydrate and restore electrolyte balance. Additionally, prescription medications can be administered to control nausea and vomiting more effectively.